So we're very keen to hear from Dr. Reem for her inputs. Thank you for accepting the invitation.
Thank you very much. Assalamu alaikum. Thank you for the gracious introduction. And thank you to the Saudi Spine Society for including this as part of the program. I'd like to start with a word of congratulations to the Society on the huge success in the first meeting. And glad to be following some prominent speakers in the session in sharing over the coming 10 minutes or so a little bit about the story of the National Transformation Program with special focus on the model of care, which is the heart and soul of the transformation program. So the rationale behind this, I'm sure many of us in the audience have heard a little bit about this National Transformation Initiative. I don't need to convince this audience of the urgency for this transformation to happen in our healthcare system. Our current healthcare system is not sustainable. We have rising numbers of chronic diseases that are hugely attributed to unhealthy lifestyle practices. We have a high rate of premature death, and that fits in closely to this society with regards to the rates of road traffic accidents, in addition to ballooning costs. Just to put this in context, this is the largest transformation that the kingdom has ever undertaken in any sector. And it is the first transformation that we have in our healthcare system. So I decided to include this slide in our presentation to build on something that was mentioned by Dr. Sullivan in the previous presentation, the role of the clinician in driving the change. We can see that from international benchmarks, even the expenditure is hugely controlled by the clinician. 87% of health spent is amenable to clinical influence. It's up to the clinician to decide what surgery to do, or what instrument to use, or what medication to prescribe, or what test to do, or what test to repeat and repeat and repeat. In addition, we realize that 10% of patients account for up to 65% of costs. And we hugely, a lot of times, based on the way we are trained, we tend to focus on this 10%. The patient with a rare condition that comes into our clinic, or we get to have an encounter with them. And we hugely neglect the majority of patients that have conditions that can be prevented altogether. So our current healthcare system is ill-prepared. We have limited preventive measures to tackle unhealthy lifestyles. This includes road traffic accidents. And as you know, one of the top 3 goals in the overall transformation initiative is to reduce the number of road traffic accidents. Late detection of non-communicable diseases, limited focus on chronic condition management, slow emergency response due to uncoordinated hospital network also fits in with trauma. And the system is not incentivized to spend in the right areas. So our system should shift emphasis on health, wellness, patient activation versus just curing illness. This takes us to the structure of the National Transformation team, which is called the Vision Realization Office, which includes 7 strategic themes. As you can see in the diagram, the model of care is in the middle. The model of care is the method in which we deliver care to the consumers. And it drives all of the initiatives that are in the Transformation Initiative. It drives and informs financing, private sector participation, digital solutions that we need. They have to be informed and fed in by the model of care and the others. I'll touch on some of the others and then build into the describing the model of care. So, as you can see in the top corner, this is on the governance and corporatization. So, separating the regulator from the provider is one of the key objectives of this transformation initiative. At this moment, the Ministry of Health is both the provider and the regulator. And so this needs to separate, and the provider will become a standalone corporate entity that will be an accountable care organization that caters to the needs of a population of patients, healthy and unhealthy, to all of their needs within that cluster. And the corporate models are typically used for delivery of care to ensure financial efficiency and operational flexibility. The structure will include a board that will be independent from the center and a health corporation, so it will be financially efficient and operationally flexible and driven by the providers in the cluster. I think I have a slide, yeah. So this feeds into speaking about operational efficiency, and this is data on our kingdom. You can see, I'll go to the bottom corner, the bottom right corner. Inpatient admissions in Saudi Arabia is significantly lower than that in the UK. Outpatient visits, similarly lower. You can look at the bed utilization rate. Compared with leading GCC private hospitals, we are lower. And the human capital, utilization of the human capital is also suboptimal. A surgeon doesn't have enough time in the OR to provide the high level of surgery that he or she is trained to do. A non-surgeon doesn't have enough clinic time or space or pharmacy or. So corporatization is based on some key guiding principles underpinned by robust, fair, and open system governance, which is going to be very important. As you know, in the Eastern region, we have the formation of the first cluster, and we are in the process of putting these pieces together. It's a very interesting experience. A word on digital solutions. This is one of the themes in the National Transformation Initiative. It will be an important part of our healthcare delivery system. We all know about the recent launch of the app that provides telemedicine for patients now for this period of time in the north and the south, provides instant consults to people that have questions. And the Saudi population is very ready to using digital solutions. Every person in a study has 1.6 smartphones. We know how we reacted to Abshir. We know how we use online banking. And so the population is very ready to using digital solutions in their care. So, model of care. What is the model of care? The square or the rectangle on the left side describes our current healthcare system, where we have these facilities that are fragmented, not connected in any way, and the patient and family are, in reality, they're actually outside the box. It's very difficult for them to navigate the system. I'm sure as you sit here, you can think of numerous patients that missed opportunities to have the care that they needed, or they came to see us too late. We heard about this in our previous presentation. I recall a patient that I saw in an outreach clinic in Hufuf that lost her vision. She had recurrent optic neuritis, never reached the right care, could have been treated, and she could have been with her full vision at this moment, but didn't have access to care. The new model of care keeps the patient and the recipient of the care, health and health care, in the middle. Actually, I want to go to this slide, and then I'll go back to the process. So the patient and the family are in the middle with the objective of attaining physical health, social health, and mental health. And this, at the moment, does not exist. The second ring is healthy communities. And you'll hear something about this. I'm going to give you a sneak peek on the next presentation by Dr. Abdelilah Hossawi about encouraging healthy communities in developing. Virtual care, another ring that still doesn't exist. The next ring needs to be empowered and enhanced primary care. And then lastly, specialized and super specialized care. At the very end, hospitals. So the healthcare system was divided into 6 systems of care. The rationale behind this is looking at health and healthcare in the eyes of the recipient. It's not about how we did our training in medical school. We trained in specialties, neurology, neurosurgery, ortho, and we hear about the importance of interdisciplinary care, because interdisciplinary care is how the recipient needs it. The recipient wants to stay well, keep me well. I don't want to be sick. Make me fasten my seatbelt. Help me have a healthy pregnancy and childbirth. Help me with my planned and elective procedure, my spine surgery, or other procedure. Help me with my urgent care condition. Help me with my chronic care, and that's the system of care that I'm the national lead for, and I have a lot of passion for the system of care because it carries about 80% of what we do in the healthcare system. And lastly, help me with the last phase of my life. Help me die in a dignified way. So the model of care was designed bottom up. And I'll back up, even if it's a little boring to you to see the slides again. The process involved a huge engagement exercise. It started last October of 2016 in the first phase of designing the model of care. It involved 6 national leaders to lead each of these 6 systems of care, and it engaged a large number of physicians, nurses, pharmacists, nutritionists from regional healthcare directories, medical cities, Ministry of Health, other government sectors, National Guard, the military hospitals, the private sector was involved, and importantly, on each team, there were a number of patients and patient representatives representing the views of the patient and how this care delivery system would be. We had 3 big workshops called care design groups, and at the end of the exercise, with this engagement exercise, we came up with the new model of care. The second slide is just sort of a visual for you to see the number of workshops and the involvement of various people in this process. I know I have another minute to go, and I wanted just to mention a couple of things before I close. We realize that not all of this is going to be provided in healthcare organizations, and we realize that we need enablers. We need the regulators to work with us. We need a workforce that may be different from the workforce that we already have. We need solutions that are digital. We need the private sector to partner with us and work with us on this, and a good payment system. This is a visual of the solutions that the first phase came up with. So there were 42 initiatives. Some of them are on the top in black, and they're cross-cutting, and they involve more than one of these systems of care. In the center is enhanced primary care services, which is going to be a very important aspect of the new healthcare system. The other point to make in closing is national guidelines, and I'll point to it. And I believe that this is where the society's role is going to be very important, having unified national guidelines for the care of patients in various conditions or disease groups. The role of the societies is going to be very important in informing what these new guidelines are going to be and helping audit their applicability. That brings me to the end of the presentation. I promise to stay after the session to take questions, or because I'm sure there's going to be a lot of questions. Thank you very much.
Thank you very much for a very impressive presentation. Actually, I'm receiving a couple of messages that requests for meeting with you by some of the members of the boards. Our next presentation is Patient Safety in Saudi Arabia, Challenges and Way Forward. It's presented